Hi, I'm Stephanie Prendergast, a co-founder here at the Pelvic Health and Rehabilitation Center. Pelvic floor dysfunction is as common as low back pain, yet many people don't know they have a pelvic floor until something starts to go wrong. So the pelvic floor muscles are involved in urinary, bowel, and sexual function. And when they become dysfunctional, people may have bladder symptoms, bowel symptoms, and symptoms of pelvic pain in both sexes. It's important because men also have pelvic floor muscles that still run from their pubic bone back to their tailbone, and they are also involved in urinary, bowel, sexual function, as well as keeping us pain-free or in pain when the muscles start to become dysfunctional. Because the muscles are so closely tied to the urethra, the anus, the opening of the vagina, and the penis, anytime they become dysfunctional, symptoms may arise that can look like urinary urgency frequency, constipation, painful sex, erectile dysfunction, painful ejaculation. It spans a whole range of symptoms that nobody thinks, oh, my pelvic floor muscles are causing these. Understandably, you think you have a urinary tract infection, a prostate infection. You think that there's a number of things that could be going wrong. The last thing anyone thinks about are the pelvic floor muscles. So today, we're going to cover each of those important functions: urinary function, bowel function, sexual functioning, and how our muscles contribute to both our exercise and just moving through the world. And we're going to talk about what happens when those muscles become dysfunctional and the symptoms that can arise, and most importantly, what you can do about it. All people have a pelvic floor, and the muscles run from the pubic bone to the tailbone. They support the bladder, the urethra, the rectum, and in women, the uterus, and in men, the prostate. These muscles are unique because they have autonomic functioning and volunteer functioning. And that is the same as like breathing. During the day, we breathe, we don't think about it. During the day, we don't think about our pelvic floor when everything is acting normally. Yet, at times, we can override the pelvic floor's autonomic functioning. And that happens when you go to the bathroom or when you choose to hold your bladder because you're not in a place where you can go to the bathroom. So we have the ability to control our pelvic floor muscles, but they also function on their own. As we go about our day, our bladders start to fill with urine. As urine starts to fill the bladder, there's reflexive activity that involves the pelvic floor muscles where the muscles become increasingly tight to keep us continent. When it's an appropriate time, we have the voluntary ability to relax our muscles to allow us to go to the bathroom. These aren't really things that most people think about during the day, but when pelvic floor muscles start to become dysfunctional, you may start to experience symptoms. And this can mean an entire range of things, from the inability to keep urine in your bladder to feeling like you really need to go to the bathroom right now when there's not enough volume of urine to actually create that sensation. A lot of this comes back to the pelvic floor muscles and their ability to act normally and then their ability to become dysfunctional. Various things can happen in our life to make the muscles dysfunctional. One of those things involves childbirth, aging. Sometimes our physical activities exceed the ability of the pelvic floor muscles to help us support our backs, our hips. And as a result, the muscles can either become weak or they can become tight. And as a range of symptoms go, when the muscles become weak, that's when people tend to leak urine. That can happen after childbirth, with age-related things, and certain surgeries such as prostatectomy or other procedures that women may go through for pelvic floor reconstruction. In our younger demographic of patients, we may exercise in a way that our pelvic floor muscles can't work with our core. The muscles start to become tight. That makes us feel like we need to urinate probably more than we do based on the volume of urine in the bladder. That can also be associated with pain, meaning that it feels like you have a UTI and it feels like when you go to the bathroom, you maybe get this pinching sensation. In order to urinate, the pelvic floor muscles have to relax. If the muscles are so tight that that relaxation is difficult, you can feel a pinch at the end of your urinary stream. That's also associated with a bladder infection, but it can also be because these muscles are squeezing the urethra, because they can't remain relaxed long enough to let you void. All of these things are quite common, yet the last thing people think of when they feel these symptoms is I have a muscle dysfunction. Many people in the United States and abroad suffer from constipation. It plagues so many people, and we think about GI function, but you also need to think about the pelvic floor muscles. When these muscles become involved, whether they're tight or they're weak, it's going to affect our ability to effectively have a bowel movement. When people are constipated, the muscles can be too tight, and it can lead to difficulty evacuating. If you're sitting in the bathroom for more than 5 to 10 minutes, it's an inappropriate length of time, and there's probably something happening with the pelvic floor muscles where they're not relaxing enough to allow you to evacuate. There is a problem in the United States where our toilets are actually too high, and many people are sitting on a toilet seat that is setting them up for failure with bowel movements. One of the things that we work on in the clinic is helping people understand that in order to effectively have a bowel movement, your knees should actually be higher than your hips, which means you may need to put something under your feet in the bathroom. And truth be told, you may see a quick difference in your bowel movements and your ability to relax the muscles. We have a muscle called the puborectalis that swings around our rectum. If our knees are not higher than our hips, this muscle actually contracts and squeezes the rectum closed, which makes it very difficult to have a bowel movement. If you raise your knees higher than your hips, it allows that muscle to actually be at a biomechanical advantage to relax for a bowel movement. Now, going back, if you are straining and you're in the bathroom for more than 10 minutes, all of these muscles are under a lot of force of pushing and things that people are doing to try to evacuate stool. That in and of itself can lead to pelvic floor dysfunction. There may have already been pelvic floor dysfunction in the first place, which is resulting in this straining, but it's basically like an extended version of childbirth that can happen every single time someone tries to have a bowel movement. Over time, that's going to have pelvic floor consequences that's going to creep into other areas of your life, such as back pain, urinary dysfunction, sexual dysfunction. We need to have these muscles in a relaxed and normal state where they can contract, where they can relax. They're not too tight, they're not too weak. And with that, at least the lower end of the GI tract can function normally to help people have normal bowel movements, eliminate constipation, and stop putting trauma to the pelvic floor. Pelvic floor muscles are involved in sexual function in both sexes. So in women, as people start to enter the arousal phase, muscles of this part, the anterior pelvic floor, start to contract, and that allows blood flow to enter the clitoris and result in clitoral engorgement, as well as facilitating lubrication from our glands in the vestibule. In men, most people can relate to the muscles also getting tight, and they help to keep blood flow in the penis, which results in erection. As both sexes go through the sexual response, they start to get closer to orgasm. And when people have an orgasm, the muscles of the pelvic floors are rapidly contracting to result in ejaculation in men, sexual pleasure in both sexes. So then, as much as these muscles are voluntarily and involuntarily involved in sexual response, if there's dysfunction in the pelvic floor muscles, people are going to notice symptoms. There may be erectile dysfunction in men, inability to keep blood flow in the penis itself. There can be pain in both sexes. If there's tightness in the muscles, it will hurt. Ejaculation becomes painful in men. They notice that there is pain in their penis, in the perineum, which is the area between the penis and the rectum. Women can feel pain at the opening of the vagina, but also in the muscles that are deeper. Women may not be able to have an orgasm. If the muscles are too tight or too weak, they can't effectively contract to give you the orgasm. People may feel soreness after they have some sort of intercourse or some sort of sexual activity. Again, you're trying to push the muscles to do something that they may not be capable of doing because they're either tight or they're weak. The pelvic floor muscles are really involved in our sexual function, and when people start to have issues with orgasm, arousal, and any type of sexual activity, these muscles are almost always involved. The pelvic floor muscles are part of our core, and they tend to act reflexively when we're using our core under normal circumstances. So under normal circumstances, when we're doing abdominal activities, glute activities, this involves planks, squats, whatever you think of, our pelvic floor muscles naturally contract when we increase our intra-abdominal pressure. Otherwise, we would leak urine and stool during activity. When the muscles start to become dysfunctional, we may actually leak a little bit when we're trying to exercise, and it may result in things like hip, back, sacroiliac joint pain. The muscles need to contract with our core, and if they are overtaxed or if they're too tight, that may not happen, and that's when symptoms start to arise. When we're in pelvic floor physical therapy, we often go through a process called neuromuscular re-education, which involves helping getting the pelvic floor muscles to work again with our core so they're on our side instead of basically becoming the enemy. So in any part of our body, including the pelvic floor, if we stress a muscle past its capacity, there's going to be an injury or dysfunction or symptoms are going to arise. That's going to be slightly different for everybody. Some people can effectively do CrossFit and have no issues. Other people may do 5 crunches and have a problem. So when we're trying to look at why symptoms are there, we will assess how the muscles of the pelvic floor do work with the core, and more often than not, when there is a dysfunction or a symptom, something isn't working together the way it should. All of this is correctable. We just need to understand how the body works and then rehabilitate it so it starts to function together again as a unit. So all of the things that I've talked about today, urinary function, sexual function, bowel function, how the pelvic floor muscles work with your core, they're all tied together. And as you may listen to this, you're thinking, I have symptoms in multiple areas. And that's true. Because it affects so many different things that we do, most people don't have just 1 or 2 of these symptoms. You may have a little bit of back pain, you may have some stress urinary incontinence, you may have painful sex, you may have erectile dysfunction, or you may have a little bit of all of it. We don't want people to think that there's so many different things wrong with them when it's really all coming down to the pelvic floor, and it's multiple symptoms of the same sort of dysfunction. The best thing to do if you are experiencing these things is to reach out to people like us, the pelvic floor physical therapists, that will help you understand what has happened to your muscles, how they became dysfunctional, and most importantly, what's the game plan to get you back to normal function.